Welcome to the Deep Dive. We're the show that takes all that complex information articles, research notes, and boil it down for you. We pull out the key insights, the stuff you really need to know. Think of us as your shortcut to being genuinely informed, maybe with a surprising fact or two you can use later. Today we're diving into something that sounds maybe a bit specific at first, porcine cystitis. But stick with us because it's actually, well, surprisingly complex and really important in agriculture, our mission. To unpack what it is, why it happens, its impact on pigs, and critically, what we can do about it. Because this isn't just some obscure condition. It causes real discomfort, hits performance hard, and can even be fatal. It matters a lot in swine production.
It absolutely does. And understanding things like porcine cystitis, it's not just academic, you know? It has very real practical consequences for animal health, for welfare, and frankly, for the efficiency of the whole operation. It links directly to the economics of farming.
Okay, let's unpack this then. Porcine cystitis, what fundamentally is it?
Well, simply put, it's an inflammation of the pig's urinary bladder. Usually, it's linked to a bacterial infection, basically a UTI, a urinary tract infection. And it often occurs alongside pyelonephritis. That means the infection has traveled up to the kidneys, too. It's significant because, well, it causes pain, poor performance, and like you said, it can lead to death.
Inflammation, bacterial, can hit the kidneys. Okay, so what causes it? What are the main bacterial culprits here?
So typically the infection starts low down and moves up. Bacteria from the lower urinary tract ascend into the bladder. The big one, probably the most common, is Escherichia coli E. coli. You hear about that a lot in UTIs generally. But for pigs, there's another really key player, Actinobaculum suis. It's a specific type, a gram-positive bacterium, and this one is often found causing bladder and kidney infections, particularly in breeding sows.
Actinobaculum suis. That's quite a name. And you mentioned it spreads during mating. Okay, here's where it gets really interesting. Tell us more about how these infections actually spread, the transmission pathways.
Right, it's quite varied, actually. The main way is what we call an ascending infection. So bacteria from the environment, or maybe the reproductive tract, especially for sows, they just travel upwards. Simple mechanics, really. But yeah, Actinobaculum suis is often passed during natural mating. An infected boar can transmit it directly to the sow.
Ah, so that explains why breeding females are more at risk sometimes.
Exactly. And then there's hygiene. Poor sanitation, dirty pens, inadequate waste management, all that increases the bacterial load in the pig's surroundings, makes infection much more likely. And one more thing, physical trauma, maybe from farrowing, giving birth, or even veterinary procedures like catheterization. That can damage the tract lining and give bacteria an easy way in. It predisposes them to infection.
So environment, breeding, physical stress. It's a combination. Which makes me ask, who's most vulnerable? Are there specific pigs we should be more worried about?
Yes, definitely. Female pig sows are naturally more prone. Their urethra is shorter, so bacteria have less distance to travel to reach the bladder.
Right, anatomy.
Yeah. And this risk increases significantly after mating or after farrowing. And as we just touched on, poor hygiene is a massive factor. Dirty conditions just, well, they fuel the fire. Also, dehydration. If pigs aren't drinking enough, their urine gets really concentrated. That can irritate the bladder and help bacteria grow. And circling back to Actinobaculum suis, natural mating, particularly if hygiene isn't great, really ups the risk for that specific bug. And finally, any trauma, like we said, from birth or procedures, opens the door.
Okay, that paints a clear picture of the risk factors. So if we suspect cystitis, what are the signs? What should producers be looking for? Are there different signs for mild versus, really severe cases?
Yes, the signs can vary quite a bit depending on how bad it is and if the kidneys are involved yet. For mild or moderate cystitis, you might see stranguria, that's straining to pee, often just passing small amounts. Hematuria is a really key sign, blood in the urine. It might look pinkish, reddish, or even brownish.
Blood in the urine, okay, that's a big one.
Definitely. They might also try to urinate more often, maybe look uncomfortable doing it. The urine itself could be cloudy or discolored. And you might notice them drinking more water, too. Now, if it gets severe or progresses to pyelonephritis, the kidney infection, the signs are much more serious. You'd likely see a fever, the pig will be lethargic, off its food, clearly in pain when urinating, maybe showing abdominal pain. Dehydration becomes a real risk. And critically, if it's not treated effectively, especially with kidney failure or septicemia, that's a bloodstream infection, it can absolutely be fatal.
Wow, quite a range from just straining a bit to a life-threatening situation.
Yeah.
If a pig does die from this, unfortunately, what would you find in a post-mortem exam? Are there telltale signs?
Oh, yes. Post-mortem findings are usually quite clear. The bladder wall itself will often be thickened, showing that chronic inflammation. You might see hemorrhages on the inside lining of the bladder, sometimes tiny pinpricks called petechiae, or larger blotches, ecchymosis. You could also find pus purulent exudate inside the bladder or even in the ureters, the tubes going up to the kidneys. And if the kidneys were involved, you might see them enlarged, maybe filled with fluid that's hydronephrosis or even containing abscesses, pockets of pus.
Very clear indicators then. So moving on to diagnosis in a live animal, how do you confirm it's cystitis? And importantly, what else could it be? Are there lookalikes?
Diagnosis usually starts with those clinical signs we talked about, the straining, the blood in the urine. Those are strong pointers. Then a urinalysis is really key. You examine the urine under a microscope and chemically. You look for blood cells, white blood cells, bacteria, protein, all signs of infection and inflammation. To know exactly which bacteria you're dealing with and what drugs will work, you really need a bacterial culture. You collect urine aseptically, or maybe bladder contents post-mortem, and grow the bacteria in the lab.
That tells you the specific bug and the right antibiotic.
Precisely. It guides treatment. Sometimes imaging, like an ultrasound, can help too. You can see if the bladder wall is thick or check the kidneys for swelling or abscesses. And of course, post-mortem exam gives the final, definitive answers in fatal cases.
Makes sense. But what about ruling out other things? What conditions might look like cystitis but aren't?
Good question. Differential diagnoses are important. Urolithiasis, that's bladder stones, can cause similar signs like straining and blood, but it's a physical blockage, not primarily an infection. Simple physical trauma to the urinary tract could also cause pain and maybe some blood without bacteria being involved initially. And though less common, bladder tumors could potentially cause bleeding and straining. But again, the key difference is the presence or absence of that bacterial infection driving the inflammation. Urinalysis and culture help sort that out.
Right, you need to confirm the bacteria. So, okay, we have a diagnosis. What does this all mean for treatment? What's the plan?
Treatment hinges on antibiotics, assuming it's bacterial. And the choice, ideally, comes from that culture and sensitivity testing we mentioned. Common choices might include things like penicillin, ampicillin, tetracyclines, maybe sulfonamides. But the key is using something the specific bacteria is sensitive to, and duration is crucial. You generally need to treat for a decent length of time, often 7 to 14 days, maybe longer, to fully eradicate the infection. Don't stop early just because the pig looks better.
Okay, antibiotics are central. Anything else?
Yes, definitely. Increasing water intake is vital. Ensure constant access to plenty of clean, fresh water. It helps dilute the urine, making it less irritating, and literally helps flush the bacteria out. We can also use anti-inflammatory drugs, NSAIDs, non-steroidals to help with the pain and inflammation, make the pig more comfortable. And in really severe or complicated cases, maybe with blockages like stones or chronic abscesses, surgery might occasionally be needed, perhaps to remove stones or drain abscesses, though that's less common.
A multi-pronged approach then. But prevention, as always, is better. Cheaper too, I imagine. How can producers stop this from happening, or at least reduce the risk?
Absolutely. Prevention is key. Top of the list is good hygiene. Clean, dry pens, effective manure removal, it all reduces the environmental load of bacteria. That's fundamental. Second, water. Constant, easy access to clean water. Cannot emphasize that enough. Keeps urine dilute, flushes the system. Then, mating management. Especially thinking about Actinobaculum suis. Using non-carrier boars if possible, and maintaining really good hygiene during the mating process itself can make a big difference.
It's heart-breeding practices.
Exactly. And regular monitoring, especially of sows after they've been mated or after they've farrowed, catching any early signs allows for prompt treatment before it escalates to the kidneys. And finally, just good general biosecurity on the farm helps keep all sorts of pathogens, including urinary ones, out or under control.
Right. Hygiene, water, mating management, and vigilance. Seems like the cornerstones. So looking at the bigger picture now, what's the economic hit from porcine cystitis?
It's definitely significant. It impacts the bottom line in a few ways. First, reduced productivity. Affected pigs often don't eat as well, so their growth rates suffer. In sows, reproductive performance can take a big hit, maybe fewer piglets born or trouble getting pregnant again. That's a direct loss.
Yeah, that hurts.
Then you've got the direct treatment costs, the antibiotics, the anti-inflammatories, vet time, labor for supportive care. It all adds up. And lastly, in severe cases where pigs die, well, that's a complete loss of that animal and its potential productivity. It really impacts herd profitability.
So it's not a minor issue by any means. This has been incredibly insightful, really drilling down into porcine cystitis. We've covered the bacterial causes, some surprising transmission routes, the risk factors, the signs to watch for, and the strategies for diagnosis, treatment, and crucially, prevention. Thanks so much for guiding us through all that detail. It's been really clear.
My pleasure. It's an important topic.
And for you, our listener, here's something to think about as we wrap up. Consider how understanding just one specific transmission pathway, like how Actinobaculum suis spreads during mating, can completely change how you approach disease control. It really highlights how targeted, sometimes quite specific, interventions in management can have a massive ripple effect, potentially preventing wider health problems and serious economic losses across the whole system. Something to mull over.